how often would I have to go in to get benefits? Is one per day okay?
More than enough, yeah. So the study I did, I purposely did it at 3 times a week because most of the studies that have been done in hyperbarics have been done at 5 days a week. And while we do get a lot of patients who'll come 5 days a week, that's pretty inconvenient for most people. And so I wanted to say, can I move the needle at 3 a week? And the answer was yes, you know? And so could I have moved the needle more at 5 a week? Probably, but I also don't want to waste anybody's time and money in our clinic. So if I could do it at 3 and that's their max, at least we know we're having the impact.
Is this like a once a year thing? You should do 30 sessions once a year, once every 2 years?
You know, you're talking to somebody who obviously loves hyperbaric and thinks it's pretty important. I've probably done thousands of hours, literally over 20 years that I've been doing hyperbaric. But I would say that most of my use at this point, you have to go through some loading phases at least to get some of those, the momentum cellularly. And then you can go into some type of maintenance program. That could be once a week, it could be once or twice a month. But really where I see the most benefit is I do clusters. So I do about 30 to 40 hours, 3 to 4 times a year.
3 to 4 times a year, so you're hardcore.
But that's, you know, I don't think that's requirement for health and longevity, but I have one in my house, I do it regularly, and I believe, you know, there's other issues, like I'm not solving for any problems, but I have a lot of dementia in my family, as an example. So, you know, I see that this is a tool as a preventative measure.